I'm Mona Shahriari, and I'm Associate Clinical Professor of Dermatology at Yale University and the Associate Director of Clinical Trials at Central Clinic of Dermatology Research. So we did something fun this year where each of us decided to take a drug class and really advocate for that specific drug class. And whether or not we feel that way, but we were going to go to town and this is our drug. Everything about it is number one. Everybody else is number two. And we're really going to help the audience see in that art of therapy selection why you would pick one drug class versus another and how you can best match the treatment to the person in front of you. We're using an Avengers theme. So each of the drugs is going to be represented by an Avenger. Hopefully there's some Marvel Universe people who are watching this are going to be interested, but I think it's a very unique approach and hopefully it'll be memorable for the audience so they can take some key pearls back to clinical practice. So I am doing the IL-13 cytokine blocker, so lebrikizumab and tralokinumab, and Black Widow is the Avenger that's representing it. So you'll see me kind of start out the conversation later today that Black Widow is not the flashiest or the strongest Avenger, but she's precise and she's strategic and she'll get the mission done without blowing up the building, which I think we can all agree is not Hulk's strongest suit. So I'll walk you through how that's going to work out. So I think one of the biggest revelations in the treatment landscape is the OX40 targeting drugs, because up until now, a lot of our drugs had been suppressing inflammation, but the OX40 pathway kind of gives us the potential for a drug that can maybe retrain and even rebalance your immune system and give you the potential for disease modification. They are not by far the fastest drugs in the world, but for them, it's more of a marathon and not a sprint. Obviously, we're going to be watching their safety closely because of some of the signals that we've seen in phase 3 trials thus far. But I think just targeting the pathway a little bit differently, above the level of the cytokines, above the level of the T cells that make those cytokines, and really going into that inflammatory prequel really has the potential to give us a different level of skin clearance. I'm the host of the Medical Sisterhood, which is a podcast that I developed a little over a year ago with the help of HCP Live, which is dedicated to women empowerment in dermatology. And I love that it's really kind of taken a life of its own at this point, where we're really helping not only women in dermatology, but also across the landscape, just women who are professionals, working moms, really better understand how they can reach work-life balance and better understand like what are the challenges that everybody goes through, and to help people kind of see that what you see on the outside is oftentimes people's highlight reel, but there's a lot of behind the scenes that everyone goes through, and that can hopefully help ground them. And thus far, we've been focusing on work-life balance and establishing that sisterhood, but moving forward, we're going to give it more of a medical twist and see how we can better apply this sisterhood to just having more connections in the field of dermatology.